Today, we're looking at something that is both incredibly specific and hugely important within the UK's National Health Service. We're talking about earning the National Clinical Coding Qualification distinction.
hmm
And this isn't just about being competent, right? We want to understand how this top tier of mastery translates into real, tangible value for the coder and for the NHS itself.
It's absolutely crucial. You have to think of clinical coders as the cornerstones of the NHS. They're the engine behind, the entire financial structure.
Because they fuel the payment by result system.
Exactly. That's how hospitals get paid for the care they provide. But they're also guardians of national health data. So achieving the distinction grade, it just signals this statistically rare level of meticulousness. It makes you invaluable.
Okay, so walk us through that rarity then. What are the actual metrics here? We're talking about something much more than just a simple pass mark.
Oh, it's extremely rigorous. To get the distinction, you need 95% or higher in the practical paper and 85% or higher in the theory.
95%.
Yeah. And that 95% on the practical exam is the real Everest. It means you've gone through a complex 3-hour exam with an error margin of less than 5%.
Wow.
And they even made it harder in 2022. They pushed the theory distinction mark up from 80 to 85%. It really increases the signal that credential sends to an employer about your accuracy under pressure.
So let's unpack this for a second. What does it actually take cognitively to maintain that kind of accuracy? It sounds less like data entry and more like, I don't know, high-speed legal interpretation.
That's a great way to put it. It demands a synthesis of, 4 complex skills all at once. You need clinical abstraction, so pulling facts from long, complex notes.
Right.
Then there's flawless rule application of the coding standards, rapid hierarchical navigation through the code books, and of course, impeccable time management. You're showing superior processing speed.
So how does showing that, that cognitive edge at the 95% mark translate into actual career momentum?
It's a powerful differentiator. The basic qualification gets you to a Band 4 role. But the distinction, that fast-tracks you straight into the competitive Band 5 senior coder roles.
And these are the high-demand jobs.
Very high demand. The distinction is often the deciding factor, especially when good coders are hard to find and even harder to replace.
And that difficulty of replacement,
Yeah.
that leads directly to financial incentives, doesn't it?
It does. Distinction holders are often first in line for posts that include a recruitment and retention premium.
Which can be, 15, 20%?
15 to 20% of the base salary, yes. Combine that with a higher starting salary point, and over 5 years, you could be looking at an income difference of over £30,000.
That's a huge uplift.
And it's compounded by a speed advantage. Because you've already proven 95% accuracy, many trusts will just reduce or even waive the mandatory probationary audits. You get professional autonomy almost immediately.
So this isn't just about an individual's salary. Let's zoom out to the trust itself. How does one coder's precision protect hospital revenue?
It protects the entire payment by results cycle. We call it the comorbidity cliff.
Okay.
A distinction-level coder is meticulous. They capture all the necessary comorbidities, the CCs. If you miss just one key condition, say severe malnutrition, the patient episode falls off that cliff into a lower-paying category.
And what does that mean in, pounds and pence?
It means a quantifiable loss of between £2,000 and £4,000 per patient episode.
Wow, over thousands of patients. That's monumental.
It is. And this precision also prevents what's called clawback, where auditors find errors years later and take the money back.
So that's financial governance. What about clinical governance? Public health reporting.
That's where data integrity becomes a life or death metric, truly. Accurate coding of, for instance, palliative care status, that's code Z51.5, is vital.
Why that one specifically?
Because it risk adjusts mortality stats, like the hospital standardized mortality ratio. If that single code is missed, a natural expected death looks like a statistical anomaly. It can artificially inflate a hospital's mortality rate and even trigger an inspection by the CQC.
So looking ahead, what does this all mean for the future of the job, especially with, AI and automation on the horizon?
Well, it actually creates powerful AI resilience. As machines take over the more routine coding, the human roles left will be focused on validation, complex cases,